Hi guys, welcome back to my channel. Today I wanted to make a quick video about CNAs. I'm actually going to be making a few videos about CNAs, but for today I wanted to do one called How Important Are CNAs to Nurses? So, um, in my opinion, I feel that they are absolutely vital and they are essential to a, a good nursing practice, a good nursing experience. Different facilities, it depends. So if you're maybe like if you're in a like doctor's office or a clinic or something like that, maybe CNAs won't be like as important. But definitely for me, in my experience, I have worked in long-term care and I've worked in hospitals, and they are absolutely essential. Um, and depending on which ones, you may need them more. So um so let's just get started. Uh the reasons I feel that CNAs are very important to nurses and to their practice is because we nurses, we have a lot of patients. We have a lot of patients, and all these people are sick, and even the ones that we feel aren't that sick, they feel that they are that sick, and they have needs. Um, I'm going to do a video on patients who kind of take advantage of that. I think we all, as nurses, once you've been a nurse for a while, we all have experienced a patient who, they could do for themselves a bit more than what they act like, and they really want to get the full nursing experience, and so they ask for quite a bit more than, what they need. Um, but for the most part, most patients really are sick. So yeah, us nurses, we have a lot of patients, and again, depending on where you're working, if you're working in long-term care where you could have 50 patients, or in a hospital like in an ICU setting where you may have two or three, or if you're out on the floor and now you have seven or eight. So that's a lot of people. Us nurses, we have a lot of tasks that we have to do. We have multiple things we have to do, and every patient wants to be catered to right now, right away. I need you now. Answer me now. Um, so having that CNA to help with help with patients and do things that are in their scope of practice that they can do is very helpful. Um, so that leads to my second point, where I had wrote down, like, nurses have many tasks. We have many things we need to do, medications, starting IVs, um, charting, communicating with the doctors, and dietary and PTOT and social services. Like, we're constantly communicating with families. So we're on the phones a lot. We're care planning. I know at my job we have to order all the equipment that we're going to need, even the IV poles and stuff. We have to order all that stuff, and we're doing wound care, putting in orders. Um, on top, we're ordering labs, we're checking labs, we're doing all this, and that's just like the nursing side, where we can't get any help with any of those things. We can't have our CNA come help us with that. But on top of all that we're doing, we're also doing, I don't know if I just mentioned wound care, but we're doing wound care. We're doing vitals, we're doing AccuChecks, we're taking people to the bathroom, we're cleaning them up in the bed if they went to the bathroom on themselves, we're walking people, we're repositioning, we're feeding, and then just bringing in things that the patient may want: food, water, ice. So it's helpful when a nurse is in a room with another patient doing something, and then another patient calls and they want water, or they want help to the bathroom. Is very nice to have that aide there who can go and do that test, that you know to help you out so that you can continue to do what you're doing with the other patient. So yeah, it's very helpful. Um, Also, CNAs are what I always say, they are my eyes, they're my ears, and sometimes even they're my voice. Now, do they replace my eyes and ears and my voice? Absolutely not. However, if I am in a room with another patient, they are another set of eyes and ears and voice, you know, for me. They can see, they're seeing something that I don't see, and they can come and relay that information to me so, I can deal with it. So, very helpful. It's like backup eyes, ears, and voice, very important. Um, let's see, what else did I put here? I also put that depending on the setting, your CNA may be with that patient more than you are. I know in long term care, when I had 50 patients, I just could not be with one patient more than 5 minutes. Like 5 minutes was pushing it. But my CNAs, they were in there with that patient, getting them up, washing them up, getting them ready for either breakfast or bed, feeding them. And while they're feeding them, they're able to talk to them. They're helping them get dressed. They're combing their hair. Um, they're doing all that, spending way more time with the patient than I ever could. So they knew more things about that patient than I did. Sometimes they would know how that person toilets better than me. There's some patients I've never taken to the bathroom before, and I would have to ask my aide, how do they get up? Like how do they do in the bathroom? Are they transferring okay? How do they eat? Do they choke when they're eating? Are they okay? Um, things like that. How's their emotional part? Do they seem really depressed or angry, or do they have any behaviors at night? Just certain things that I wouldn't know, because again, I'm only spending a few minutes with them versus them spending hours with them. um, and then the last thing I put down, which I think we all should know as nurses, please treat our CNAs good. Don't overwork them. Don't treat them bad. Don't take advantage of them. If you can help out, help out. If you can go and get something, if you're not busy, just because you can ask your CNA to do it doesn't mean that you have to do that. If your patient's asking for water and you're charting, or and you see your CNA come out and they just sat down, like, you can get up and go get the patient some water. Like, yeah, true, you can tell your CNA, hey, they need some water or whatever, but just try not to work your CNAs too much. We need them. They're very valuable. You know, we need them. Let's not scare them off or run them away. So I hope, you guys found this video helpful. Let me know what you think. Do you feel that CNAs are that important to nurses, or can we do without them? So let me know what you think in the comments. All right, thanks. Bye.